Good morning. What can I help you with today?
Good morning, doctor. I have received a letter about bowel screening. I would be grateful if you can tell me what it means and what should I do.
I'm glad you've come in today, and I will try and explain to you this invitation. Bowel cancer screening is the test looking for tiny amounts of blood in a stool sample, which can be an early indicator of cancer. This means that bowel cancer is picked up at an earlier stage when there are no symptoms, and this is when treatment can be the most effective. Sometimes cells in the bowel grow too quickly and form a bowel polyp, which can also bleed into the bowel. Polyps are not cancers and can develop into cancers over time. So finding these polyps means they can be removed and therefore prevent bowel cancer.
Okay, I see. Can you tell me more about bowel cancer?
Yes, of course. It is one of the most common cancers, and over 40,000 people are diagnosed every year, and over 15,000 die each year from this. Most are in those over 50, but new cases are also being diagnosed in those under 50.
Oh, that is serious.
Yes, it is. But bowel cancer is treatable and curable, especially if diagnosed early. Nearly everyone survives bowel cancer if diagnosed at the earliest stage. However, this drops significantly as the disease develops and spreads. Early diagnosis saves lives. Therefore, regular screening reduces the risk of getting and dying from bowel cancer.
So who is eligible for the screening?
It's offered to people aged 54 to 74, and we're gradually expanding it to those over the age of 50.
And how often is the screening done?
Screening is offered every 2 years.
And how does the test work?
Eligible patients like yourself get a home test kit for bowel cancer in the mail. This is an example of a test kit. It comes with instructions, a tube for collecting the stool sample, and a prepaid envelope to send it back. You then just collect a small sample of stool at the end of here, scraping it off the stool, put it in the test tube, put it in the envelope, close it and mail it to the lab.
How do I collect the sample?
A tip on how to collect the sample is to use a clean disposable container in the toilet and add a few layers of toilet paper on top. This will make it easier to collect the sample. By the way, it's best to collect your sample when you're not having a period and avoid the 2 days before or after you bleed.
So what should I expect from the results?
You'll get the results back within 2 weeks. If there's any trace of blood detected, it could be for a number of things, not just the early signs of bowel cancer. A letter will explain the results and if you need to do anything next. It may mean you'll need to take further tests like a colonoscopy, which is a camera to look into your bowel, to look for the causes for the blood. If no blood is found, you'll get a letter saying everything's normal and you'll be invited to be screened again in 2 years.
So what are the risks and benefits of screening?
Early detection can greatly improve treatment success and lower mortality rates. There are some risks, like false positives, which means that the test picks up something even though the person doesn't have cancer. They can cause anxiety naturally and lead to extra tests. Rarely but possible, screening tests miss a cancer known as false negatives, and sometimes we might find conditions that don't need any treatment.
So who is more likely to get bowel cancer?
That's a very good question. You may be more likely to get bowel cancer if you're over 50, smoke, or you're overweight, or you have a close relative who has bowel cancer. You can also have bowel cancer if you've got a history of inflammatory bowel disease, which includes Crohn's disease and ulcerative colitis, or you have small growths in your bowel called bowel polyps. And lastly, you may be more likely if you have some specific genetic conditions.
Like what?
So that would be things like Lynch syndrome or familial polyposis. In this case, you'll get a colonoscopy every 2 years starting at a specific age based on your syndrome variant, which the hospital will check for.
That's interesting. So once this is done, do I need to do anything to check this in future?
No, the NHS sends out the home test kit automatically to eligible people registered with a GP. Just make sure your address is always up to date with your GP practice. If anyone is over 75, they can request a kit every 2 years by calling the free bowel cancer screening helpline, which is 0800 707 6060. This helpline gives advice on how to do the test, even if there are complications like a colostomy or ileostomy and need any other advice.
Thank you very much for taking time to explain. I will definitely get this test done in the next few days.
I'm glad I could help. Remember, screening saves lives, as early pickup means that nearly everyone survives bowel cancer if diagnosed at the earliest stage.
Thank you very much.